There you go.
Okay. Hi, everybody. Heather just joined us too. Tom, Victor. Rena, can you hear me? Hi, you're a co-host, okay? In case I need, and then Edwin, when he gets on, will become a co-host. But just give us a couple more minutes, okay?
Okay, got it.
And Laquita, when you're talking.
Okay, we have 4. Our new committee, we have 10, y'all. So we need 6 more quorum. Another couple of minutes. Are you on now? I sent you a message. I couldn't find the tape, but I sent the minutes out. Is you the one that's I don't see her. He was, but not now. Yes. She is? Yeah. She's not. Bring her back in. No, I think she is. Just like you don't care. She's still there? Yes, she's there. Tina, Daria, Jonathan, Matt, Manhattan, oh, Manhattan. Boy. Oh, okay. Muted though.
Hi, Monique.
Kelly.
Yes, good afternoon or good evening.
Greetings. Listen, I'm gonna need your help. You know how to, when we need to show the agenda, because I'll have 2 things in front of me, this big screen, which I am monitoring for the first time, and I have some notes. So when we need to show the agenda at the outset, can you pull that up? I put you in as a, what is it? Chair or
Co-host.
host? Can you do that?
Yes, that's fine. Quick question. The agenda that was sent, it was sent in the body of an email. Was it also sent as an attachment? And if so,
Well, yes, Youth sent it that same evening as an attachment.
all right. So give me a moment to locate it so I can open
You
it.
have a, okay. And then
And
let
then-
me make you, let's see.
And then I can pull it. Then I will show it.
Okay. Let me go back to mute for a minute.
Huh. I'm not, okay. I am not seeing her sending it. Hold on. Oh, okay, there it goes. So many emails. Okay. And let me do one more thing and then we'll be good to go. Okay. All right. All right. Very good. I have it. So if you awarded me co-host ability so I can share it? Laquita?
Yes,
Okay. I
I
don't,
think we have a quorum. Let's see. Hi, Patricia Ramos. Let's see.
okay.
Hi.
Oh, there it is. Thank you. So from time to time, I'm gonna need you to, as we go to the next topic, I just need a few more.
Okay.
Okay, hold on.
Good evening, everyone. Did people hear me?
Yes, hi.
Yes, we can hear you.
Yes, can hear you.
Oh, okay. I said good evening, everyone.
Good evening. Monique.
Good evening, Monique.
Good evening.
Okay, I
Good
thought I was
evening.
speaking to some
No.
cadavers.
Hello, good evening, everybody. So we do have a quorum now, and we've gotten a number of other things adjusted. I'm going to, let's see, I was going to see if I could be off the agenda, but after, and do a little introduction. So Monique, if you could move the agenda for a second, and then I can say hello to everyone, and we can see each other. My name is Laquita Henry, and I am co-chair of Health and Environment. Welcome to everyone here. And this is the start of a new fiscal year for us. I'm so glad to see those present. We have a couple new members. I know Lydia has sat in before, but we have Lydia Gerson, who's new to our board. But I believe, Lydia, you may have been at the June Health and Environment meeting. I'm not sure, but I think you were just going to.
Yeah.
You, okay. So welcome to our committee. And then there's Patricia Ramos, who is new to our board, and this is her first meeting. Hi, Patricia. It's my first time meeting Patricia as well. So welcome, Patricia.
Thank you.
And let's see, I don't know if there's any, we should have a quorum of committee members. And I know that Edwin had wanted to say a few things, but when he gets on, I'm sure he'll speak his piece. And so we have a number of the items on the agenda, and if Monique not only is our vice chair of our community board, but on our member of our committee, there she goes. I was just about to ask to show the agenda. And so I'd like to have a motion to adopt the agenda.
Motion to adopt the agenda as presented.
And all those in favor?
Aye.
Okay.
What's the second?
Is there a second?
I'll second. Edwin.
Oh, Edwin's on. Hi, Edwin. I just mentioned you.
Yes,
Okay.
hi. Hi, everyone.
Thank you, Edwin.
And so the meeting, all those in favor say aye to adopting the agenda, all the committee members.
Aye.
Aye.
Then next is adopting the minutes. We do not have minutes. We have minutes. They need to be shortened because we have a transcription. So right now at our first meeting, we do not have minutes. That's been for several meetings because of this process and all with me and trying to have the time to go through this and setting up the right kind of format for our doing it. But every meeting is transcribed. Let me just make sure the recording is on, darn it. Oh yeah, it's on. And so as long as it's transcribed and recording, we do have actual minutes, but they need to be.
Laquita, so we can make sure that we have the minute. And any other member of the committee collect the minute for today?
Is there someone willing to make notes of our meeting today, just the highlights? Do you have someone? I'll try to make notes as we go along.
Yeah,
But
I mean, Wait, let's wait until we get a volunteer, because we don't want you to conduct the meeting and also collect minutes, but we can have
Yeah,
a
it's
volunteer,
really-
that would be very helpful.
If we have a volunteer, that would be good. Hey, Patricia Ramos or Lydia Gerson, or I don't know, I know Monique is doing a lot. Any of you volunteer? I just take some notes. Doesn't have to be perfect. I just need something to go on, just to.
It takes a team effort, folks. We need your help.
Okay, so, you know, everyone does do a little something and then take a picture of it and text it to me or email it to me, and I can go from there. We have next, Edwin, I just want you to know, Edwin is a co-chair of Health and Environment. He's has joined us, and I did introduce two of our new members, Lydia Gerson and Patricia Ramos. We do definitely have a quorum. I think everyone, with the exception of, well, maybe two people, maybe one, are not here. Moving forward, though, there's a lot that's been happening in the area of health and environment. And there are members of our committee who are really, really active and concerned and very involved in the community and being a real resource. So much was going on during the summer, a whole lot more than I might have imagined. So there's been a lot of discussions, and some of the discussions you may want to bring up as we discuss issues this evening that were going on during the summer, or I might mention one or two items or text you some articles. But there was a lot of activity in terms of texting information of what's going on in the city. A lot of it has to be mental health issues and guns, or those issues that lead to gun violence, or gun violence leading to domestic disputes, leading to trying to resolve them in a violent way. It hasn't been super pleasant. In addition to COVID, thinking it's on the downslope, but in some instances, a little bit on the uptick, but it's in we're in a precarious position in terms, so that we still have to be vigilant. In addition to that, the monkeypox, and then there's a rise in polio. So there's been a lot that's going on. Our plate is really full, but we have to find some ways to tackle all of the issues as they all impact our district and the city, therefore, overall. Let's start with Mr. Padmore John with the New York City Department of Health and Mental Health. And Padmore, if you could give us an indication of how that department is handling pressing issues and things that we should know.
Sure, and good evening to everyone.
Away now, Monique, that'd be great.
Oh, sorry. Okay, you want me to stop? Okay,
Pat Moore.
Yes, can everyone hear me?
yes.
Hi, good evening, everyone. Thank you for the invite, Laquita. It's always a pleasure to be on this, specifically this committee, the Health Committee and Community Board 9, having served on that committee as well at some point. And so
Former chair of this committee.
Former chair, if I recall,
Chair
yes.
of the board of District 9.
That's right, long time ago. And it's always a pleasure to be here. So thank you so much. Yeah, as you have said, Laquita, there's a lot going on, and we're gonna try and us at the Department of Health gonna try and maintain awareness to all the various situations that's happening, and of course be as supportive and responsive to the needs of the community as much as we can. Of course, we also would love to hear from the community in various specific things that are happening on the ground that we may not be being aware of, and how we can be best responsive and supportive of some of the activities that are happening in parts of the neighborhoods. But as you have indicated, there are a few key items I know that everyone have concerns around, and I'll start with polio. As many of you have heard, there has been, and this is one of the things that kind of came out through COVID-19 in terms of a little bit more awareness of the wastewater system, and there's been a lot of surveillance of the wastewater systems for COVID-19 in terms of the very different variants, but also for other forms of transmittable diseases and how of catching them as early as possible. So that's one of the ways we were, it wasn't necessarily the Department of Health, the city Department of Health, but the state Department of Health that conducted some of these wastewater surveys and was able to get better awareness of what was happening in some of the different counties where we're starting to see polio. So if many of you may not have heard, the governor signed an executive order to deploy the state emergency management plan to provide support for healthcare providers that can administer the polio vaccine. And so that means healthcare providers can now start to administer the polio vaccine. And so that includes pharmacists, EMTs, midwives, and more that can now that are able to conduct vaccinations of individuals who are identified as being unvaccinated for polio. I think that right now that's the most critical issue, is the fact that those who are unvaccinated, especially children, should get vaccinated immediately. If you're an adult and you don't know your vaccinated status, they're able for you to be you can reach out to your healthcare provider to be able to find out that information. There is also the ability for you, definitely you should have conversation with your healthcare provider if you're unsure of your status or if you think you need to get vaccinated, but it's really important that this is done as quickly as possible. For children, some of this, especially here, if you have a child who was potentially vaccinated within New York, there is ability to check up on my vaccine record to be able to see the records of children. So that's a link I'm gonna put in the chat right now for all parents to make sure that their children has received that vaccination. But we definitely want to make sure that this is an active response by parents, by anyone who may have suspected that they may not necessarily have been appropriately vaccinated. Right now, there are a variety of healthcare providers that are being able to conduct vaccinations, as I indicated earlier. More information is being provided on the New York State Health website. The New York City Department of Health website also have some information about polio and various places where you can go to get the vaccine. You can also call 311 if you do not have a healthcare provider to be able to get connected to a vaccine provider. So I just wanted to make sure that everyone realized, we all know some of the outcomes of polio, the challenges that it has, and the very high need to ensure that especially children are appropriately protected at this point in time. I just want to let it known that if you previously had vaccination against polio, you will not be affected, right? The majority of folks have been from very young. I know I was vaccinated when I was a young child, and we are all good. But for those who believe they have not been vaccinated, they are unsure, they definitely need to make sure that they're taking this serious and do the appropriate precaution in being able to reach out to your provider or to determine whether or not your child may have been appropriately vaccinated. I'll stop there really quickly. If there's any questions very specifically on the polio.
Thank you, Pat Moore, for the report. As we can see, I put a link here. MCB9 has one of the lowest vaccination rate when it comes to polio in the city. How can the health department help increase awareness in the community? I seen that what happened in Rockland County was that the Department of Health has some vans coming out to this community to provide a vaccination. Education is important, so is access. But we have to make sure that CB9 reflects some of the other communities where the geographic location provides you extra benefit. And I want to know if we can get the Department of Health out here with a campaign. We have these kiosks that the community sees throughout. And polio is not a benign virus. People get it and some might become paralyzed from it or lose their ability to be mobile. So how can we get folks into, CB9 can look more like the city, right? 86% vaccination rate. We are about 70% in CB9.
First and foremost, I just want to say congratulations to you, Dr. Torres. The
Thank
last
you.
time I think we spoke, you were on your process of getting your PhD, and I see you've done that. So congratulations.
Thank you.
And thank you for constantly being a outspoken voice for the benefits of the health benefits of the Community Board 9. There's different things, we'll continue to be broadcasting a lot of the information and messaging through a variety of platforms. Some of these platforms include partners, community-based organizations that we have contracted with in the past that have been supportive of COVID-19, that have been supportive. Some of them are doing monkeypox, and we're looking to see how we might be able to get them to be supportive of getting the message around polio as well. We are always open to be able to identify means and methods of being able to be supportive or work closely with the community board in terms of getting messaging out there. So that's something we definitely would be able to work a little bit closer with you. Whether or not we might be able to bring vans to conduct vaccination, that may not necessarily just because of the resources and the lack of resources being able to do that, but definitely to ensure that folks in the Community Board 9 area know the locations of where they can go. Some of these are some of the city hospitals that are conducting this right now, as well as community-based FQHCs that are undertaking some of this. So we can definitely touch base, Edwin and Laquita, in terms of a little bit more information in terms of locations, other information. There's a lot of information that the Department of Health right now is finalizing and developing in terms of getting out there for awareness. And that's something we can definitely ensure that is coming to the two of you that can be shared with others in the community.
I know that now with social media, we can do targeted advertising. And, folks in our community, they use the Instagram, they use the Facebook. Is there a possibility that we can use some of these targeted advertising so we can make sure that CB9 is getting that information about vaccine for polio?
Yeah, this is something that we have done in the past, and it's something we might be able to do. It's not an easy lift, as that's taking that the space on the different platforms. We have to go through a process of getting it approved and everything else like that. But it's definitely something that we can have further conversations in terms of being able to get very specific messaging. And this is part of the relationship that we have with our partners as well. And one of the things I would say is that when we have in the past encouraged partners to utilize some of the information on our website and spread it to their various different communities as well. We, as much as possible, try to translate all the information to a variety of languages. Most of the languages are spoken throughout the New York City. We understand that there are certain populations that are very difficult to get access to. I know personally that there are some non-Indigenous, non-Spanish speaking populations within the Community Board 9 area. And so being able to ensure that those communities are being targeted as well and make sure that that information is getting to them It's a way that can be very supportive of the relationship with the board and other community-based organizations. But for sure, we can definitely work closely in terms of making sure that that information is getting into the correct hands. I think there are two other questions, Monique and
Thanks.
Lydia. I'm not sure who added hands up first.
Yeah,
Go ahead, Lydia.
before, excuse me, Monique, just for a second. Edwin, your co-host also, can you help me monitor the chat? In terms of questions at all? Okay,
Yeah,
thank you,
no
Monique.
Thank you. I think Edwin got at one of the questions I had to you, Padmore, in terms of getting the information out and possibly using the kiosk in the community and making sure that we are utilizing a multilingual messaging, because we need to be aggressive in terms of the messaging that gets out to those in our community. One question I had, Padmore, is you mentioned that the pharmacies around here might be able to give out the polio vaccine. Did I hear you correctly?
Yeah, some pharmacies are beginning to get it in stock. I'm not sure exactly which ones as yet, but we can definitely take a look and see which ones, but some of them are starting to get that in stock and starting to distribute.
And as well as some of the community-based health centers.
Correct.
So I just want to make sure that is there a charge that will be expected for one to pay if they are asking for the polio vaccine?
Not that I'm aware of. Now, of course, in certain instances, I don't necessarily think it's like by COVID. So that means where there was no charge, right? Because it was being covered by the government. Now, typically for the COVID, for polio, it will be through insurance. Of course, I think for children, it's a little bit different. They may be able to get it much more easier, especially through their their pediatrician. But for anyone else, it should be covered by insurance.
Okay, I just want to make sure there are no barriers if we're going to blast out that people access this vaccine and we're trying to encourage them to take it. I don't want people to come up against any barrier when they walk in and there's an expected cost.
Right. No, there shouldn't be. And of course, I know that not necessarily everyone in our communities have insurance. So that's why part of it is that if you're able, can call 311. There are measures by which the city is trying to provide this for those who do not have a primary care provider or have insurance, that they may be able to be supportive of that process.
All right. Thank you, Pat.
Okay, you're welcome. I think there's a question.
Yeah, there was one other, and then this is exciting. Deborah Levine has stated in, I see it in the chat now, Edwin. CUNY SPH Vaccine LC is happy to help CB9 with social media and community campaigns. That will be fantastic. So we'll set up communication with that, unless there's something else, Deborah, you wanted to add to that. But
Laquita, I do know that Lydia has a hand up, and then there's a question in the chat. And when did they stop giving polio vaccines to children?
Yeah, that's my question. I'm a little sorry. I mean, I know I got one as a child in the 60s, a long time ago. It was de rigueur. Everybody got it. You went up for the sugar cubes. So when did they stop doing that?
Well,
no.
Well, the thing about it is that at some point, for most countries, I think the only two countries were Afghanistan and Pakistan, polio was eradicated. There was no really any indication that polio was in systems and everything else like that. But only recently, we have started to see some indications, individuals who have decided not to get vaccinated and not vaccinating the children, that there is a recurrence of some of these of polio. So since I think maybe the 80s and then right now, young children are regularly given polio shots when they go to the pediatrician. That's one of the first initial shots that are being provided. But
so they are doing it.
They're still doing it. Just a decision that some people are making to not get the polio shots.
I think
something similar happened with measles.
So there was a paper that was published, I believe in 1998. And this, this Dr. Wakefield came up with some allegations that, in vaccinating your kids was harmful. They will have higher risk of all these things that he was claiming there. Lydia, one of the things that, for your mother, it was very scary is polio, right? Back then, it was very present. People knew, they saw polio, they saw mumps, they saw measles.
I went to school with kids that
Yeah.
had polio. That's how
And
old I am.
now you have an entire generation who has not seen this. You
Yeah.
have providers who have not seen it. And, with the internet, a lot of misinformation has come around. And all of a sudden, you have seen a lot of virologists, microbiologists, folks that go on Dr. Google with his resident, Dr. YouTube, and all of a sudden they become expert. And this is why you have this resistance. And if you can see the map that I show, the heat map that is there, communities of color with, less level of education, some of them, they're the ones that are the mostly target by this misinformation. So we have to fight back and let our community know that these vaccines are safe and we have been using them, and that these are, communicable diseases that not up until so long ago, they used to be the #1 killer for human. When we became very good at managing them, now we have people dying from heart disease because now they can live longer. So these are, bugs that we fight and that they live in this world with us. So, yeah.
Thank you. And I'm thinking with the reference to safe vaccines, that may be an area where with our community, we have some kind of media campaign and conversation about addressing those concerns. That might be, and that could cover polio, monkeypox.
Yeah, I mean, part of the thing, one of the things that the agency, Department of Health has done is really get contracted with a lot of community-based organizations to help the messaging that is going to a variety of populations. We don't even want to say that the way we message to Manhattan is the same. Uptown versus downtown, even parts of Harlem, East Harlem versus Central Harlem versus West Harlem, the different, different populations.
You're on?
And different ways we want to make sure that that they're getting this information. So but some of the community-based organizations we contracted for COVID is really all about that. It's not just speaks very specifically just to the COVID vaccine, but to vaccination in general. And part of it was to develop this trust between participants and their healthcare providers. So we are hoping that part of that trust development that occurred as we were speaking about COVID carries over, and that can be some supportive of individuals having faith in the system, going into the healthcare providers, having conversations, asking questions, but then ultimately being able to make a decision that is best for their families and for themselves. So we're hoping that spills over continuously as we work with more community-based organizations around vaccine messaging and information around vaccines in general.
Now, were there other questions? Are there other hands up? I can't, I'm not seeing.
So I just have COVID. Today I took my bivalent shot. So that is the Pfizer or Moderna. I took the Pfizer BA4 and BA5. I was approved by the FDA. So it's recommended that folks get the booster. What is, the effort, Patmore, so we can continue to help our community get vaccinated and get protected? To help people understand history, again, after 1916 was when we started to give flu vaccines. Before 1916, the Spanish flu, we didn't have it, so people didn't need to get it. After that was that we developed these vaccines, and we came up with a yearly flu vaccine. And you know that if you get a flu vaccine, the chances of you getting sicker is decreased. Now we have COVID, and there's conversation that there's going to be a yearly vaccine. We'll see what happens. But today, the recommendation is to get, the bivalent vaccine, speak to your provider. And I would like, to see, Patmore, how are we continuing this effort so we don't end up back where we were a couple of months ago.
Yeah, thank you very much, Edwin, and I thank you for that push. But I'm glad to hear that you did get your booster. And as Edwin says, the Pfizer and Moderna bivalent COVID-19 boosters have been authorized by the federal government, and they're recommended by CDC and the agency to get these. So just a little bit quick updates on that. Anyone who is 18 years and older are eligible for the Moderna bivalent COVID-19 booster. Okay, so if you're 18 and older, if you're 12 and older, you're eligible for the Pfizer bivalent. And if it has been 2 months since you completed, the primary vaccination or the last booster dose, so for some folks it was just 2, and then the third booster shot. So this will be 2 months after your last booster shot, and you're 18 and older, you're eligible for the Moderna bivalent. If you're 12 and older, you're eligible for the Pfizer. Now, you can get either booster brand, regardless of the brand for your primaries that you initially got. So if you initially got 2 Modernas, it is fine for you to get a Pfizer, and vice versa. So there's no issues around that. For children under the age of 18, the recommendations are pretty much the same. Ages 5 to 11 who receive Pfizer. Primary, they should get the one monovalent booster at that time. 6 and older who receive Moderna, they should also get that same Moderna. They cannot, for you to, and I know obviously in certain spaces, some of the places that were conducting the vaccinations in the past, some of these have closed. So I'm gonna put in the chat a vaccine finder, which is basically something being run by the city, by the Department of Health and for the city to be able to determine where some of the spaces that these vaccines are available. Now, some city located sites have closed. There was a site at my building in East Harlem, 115th and Lexington Avenue, that is no longer providing the vaccinations there. But there's a lot more pharmacies, and most of the federally qualified health centers are providing that. So it's an opportunity for you to get it there. But as Edwin said, it is very important that those, especially those who are, have some sort of compromised health systems, whether you are hypertension, have cardiovascular disease, any type of stuff like that, we encourage these individuals to make sure that they get those booster shots. And yeah, I'll stop there if there's any other questions.
I will add one more thing to what, in the COVID conversation. We still don't know what we don't know about COVID. Not enough time has passed by for us to understand the full, scope of issues that is causing to our health. If you look at some of the preliminary data that has been, coming out, higher risk of Alzheimer's, higher risk of Parkinson, cardiovascular disease. So talk to your provider. Please have a conversation, spread the word, because we have a vaccine. And this is not the first one that us humans get to have a better chance at living. In the 1900s, people used to die from communicable diseases. Now today, we've gotten better at vaccinating people and helping them live longer. So please have that conversation.
Yeah, I just want to also just put one more push out there. Please be aware of COVID, long COVID. Many individuals have had COVID and they recuperated, but there's some aspects of themselves that they just don't feel like they were prior to that having the disease. We encourage you to have a conversation with your primary care provider. There are a few hospitals and systems that are currently doing some amount of study. I know Mount Sinai has a center of excellence for long COVID, so does New York Presbyterian. The H+H also has a center where they're providing support, and that's being stood up much more. But if you don't feel, if you did have it at some point where you had COVID, you're exposed, you were tested positive, and you don't feel like yourself, and I implore you that if you have this conversation, if your healthcare provider and they're like, no, it's fine, everything is, go speak to someone else, because to some extent, so many of the providers just do not know what to expect, and what are some of the challenges that individuals are facing. But you as an individual know your body better than anyone else. Advocate on behalf of yourself, advocate for your friends and family. But it's very important that that is taken seriously and you look to address it as early as possible.
Exactly. Thank you, Pat Moore. If there's nothing else right now on that topic, we always welcome Pat Moore and Department of Health and Mental Health at our meetings. And so we'll be hearing more and be kept up to date. There's a lot of good information already provided.
Sure.
Thank
Laquita, do you mind?
appreciate it.
Sure. Can I just say a few quick things around monkeypox?
Okay, okay.
Just to say, I'm gonna put into the chat a portal right now in terms of anyone who wants to try and get. I'll put in the chat, well, the portal as well as the phone number for anyone who is trying to get access to vaccines. I know that sometimes that can be difficult. I also know that there are members of our community that are not very easy getting online. But there is a number that can be called in terms of setting up appointments. And again, there are some city-run sites that are conducting these vaccinations. There is a 2-dose regimen for when you go in. You can walk there. Also, walk-ins are available at all. Welcome at all city-run sites, so you do not necessarily have to make an appointment. It is recommended that you do make an appointment, but you do not need to have an appointment to go. But this is only at a city-run site. For some of the private-run sites, whether it's a urgent care center or a healthcare family qualified health center, please make sure you're making an appointment. But for the city-run sites, you do not need to make an appointment. You can just walk in. Once you do go into that to the site for that first time to get that first dose, they will set up an appointment for your second dose to ensure that you get in the full regimen. But again, we're just making sure that this, there's a lot of misinformation out there in terms of the individuals who are get sick. This disease is spread by contact. It doesn't have to be sexual contact. So please make sure that if there are certain things that you're seeing, that sometimes the side effects are tiredness, headaches, and muscle pains. There may also be some redness or swelling, soreness, and itchiness that may occur. But just please make sure that, and obviously some of you have seen some of the outcomes, the bumps that occur around where the infection may happen. But it's very important that, if you believe that you are going to be in a situation and maybe interacting with someone, that it appropriately for you to be vaccinated. So thank you very much for having me here, for continuing to allow us to have this conversation. I'll definitely follow up on some of the communication campaigns that we are speaking about. And I'm happy to be part of the ongoing new season for Community Board 9 as it addresses the health of the community. Thank you.
Thank you. We want to move ahead rather briskly. At this point, I had failed to include, because I hadn't heard, gotten a confirmation on the name from Council Member Shauna Bray's office, but I had talked to them very early about policies, legislation that they're looking to related to health and mental health at City Council. if, I think it segues nicely from Department of Health dealing with and moving to the city, if you guys will allow that. Remarks from Amber Moyer. I understand that she is here representing Councilmember Shauna Abreu. So if you could, Amber, hello.
Hi, thanks for having us.
And I'm hoping you could spend a few minutes, we'll try to, move the meeting along, but dealing with policies related to that, the council member, our council member, Shauna Abreu, is working on as it concerns health and mental health
Of
in the
course.
city, but in our district.
Sure. So I can talk about a few things, but I'll keep it brief. Our big project on mental health is one that we're working on with the chair of the Mental Health Committee and with Councilmember Abreu's own committee, which he chairs, which is the Committee on Federal and State Legislation. What we learned early on about mental health was that there's a lot of confusion in our provider system. And that comes from the fact that mental health is very complicated. When folks are struggling with a mental health issue, they often have diverse needs that are met by a variety of agencies at the city level and at the state level. And it's often really hard, if you've ever cared for someone who is in need of these services, to figure out where you get what. You might need to find, supportive housing through one agency. You might need medical assistance through another agency. You might find financial assistance through yet another agency. Some of them are through the state, some of them are through the city, as I said. And so what we're really tackling is that problem. We have sponsored legislation that will create a one-stop shop for mental health services. Everything from the state and the city level, and that will basically require city agencies to coordinate. So, when you are trying to figure out what services you need and where you get them, there's one single website, there's one place you go, and you're able to figure out from there what sort of paperwork you need to fill out, who you need to be talking to, and just sort of lift that layer of bureaucratic stress that so often comes when you're navigating these tough situations. So that's what we're proudest of right now and what we're most excited about and really looking forward to. We have some other projects. For example, we recently co-sponsored legislation related to syringe buybacks, which helps, encourage drug users to find their way to facilities where they might be able to receive some additional support and some help. And we, of course, are very interested in a number of approaches that protect individuals who are not necessarily managing a mental illness, but might be at risk of developing a mental illness. So we want to, make sure that we're supporting kids. We want to make sure that we have more counselors in schools, that we have more community schools, more psychologists in schools. We want to make sure that we have after school programs so that we have adults who are in the lives of children and, people who can be there to intervene before they reach a crisis point. And we're investing in programs that support students during the summer and young people during the summer. So the Summer Youth Employment Program, it supports young people up through age 24, ensures that they have an income, ensures that they have a safe place to be and a productive place to be. And those are the kinds of things that really support mental health before it reaches a crisis point. So we're really trying to hit the full spectrum there. So those are the big hits on our legislative side and our budget side. But I'm also here tonight because I know we're going to be talking about 1727. So I'm happy to stop talking now and, and let the agenda move forward, but also circle back for when we talk about 1727 and Emma Bowen, which is another organization we're extremely proud to support.
Okay, thank you. Yes, indeed. Thank you, Amber. But I'm sure there's some comments related to policies and legislation. And one of the questions I had, and you can answer it all at once, I think Edwin has one too, but what agencies or resources are you using for information to help develop, a statement or legislation? I'm sure Community Board 9's agencies would be available, or members of our committee might want to. There are ways in which we can lend some support to legislation as well. And then Edwin, and then Amber can respond at one time. Edwin, did you have something you were adding?
My question was more. I would like to see, which bills this other council member is, proposing and supporting. So if she can please share that with us so we can see these bills. And then back to what you said, Laquita, coming back to CB9, what are the efforts that we are trying to implement as a priority to help folks in CB9, bringing it back home? So I would like to see what are these, I like what you said, Amber. These are, statements that I think all of us agree with, but I would like to see the concrete step that we're taking, bringing it back home, and the bills that you guys are working on.
Sure. So I do apologize. I don't have the exact bill numbers in front of me, but I can pass those along to the group tomorrow. But the two big bills are the creation of the one-stop shop for mental health resources and the syringe buyback. Those are the two big ones that we're thinking of right now. And I have to say that the one-stop shop, that is something that has come up from our own constituent services team, in terms of just us trying to help folks in District 7 and in CB9 trying to navigate the system. So we've sort of seen that need firsthand. And of course, the struggles with drug use that does especially hit our district. And so it's something that we want to stay attuned to, and making sure that we're monitoring that pretty closely.
And from our meetings, we've had some big discussions related to those topics. And when we have our minutes nicely coordinated, hopefully we can get those over those minutes and those over to you, as well as we'd like for you to call on us, but have an opportunity to read some of the presentations from the mental health representatives and organizations that have come before Community Board 9 will be important. And so I will certainly get that information to you.
Absolutely. I really appreciate that. And I forgot to address this, but we are always looking for good ideas. Our best ideas have been those that came to us from the community. And so anything that your committee is working on, any proposals for legislation that you would like for us to pursue, we would love that. Any brainstorming sessions that you would like to have with us, I can't tell you how much we would appreciate that, and would love to tackle that. You guys have so much expertise, and I know see so much of what's happening on the ground in CB9, and really doesn't get better than that in terms of crafting legislation.
So we'll try to arrange that, and certainly by having some conversations or a series of conversations in addition to what we'll send to you. And maybe we could set up something end of this month or October, at least to start a conversation by phone.
That's wonderful.
Okay. And that brings us, since we're talking about policies and legislation, before getting to 1727, we have Lewis Bailey from We Act, and they have been so prominent in the community on the environmental issue, which is also critical to everything that is happening in District 9. And when we discuss mental health or physical health. Lewis, are you ready to tell us about some of the legislation you're putting forth. I know you guys are doing a lot, so the whichever format or abbreviated format, because I know you just had a fantastic membership meeting on some topics that are extremely pertinent.
Yes. Yes. Good evening, everyone, and thanks, Laquita. Thank you for this partnership of the board and We Act over the years. We won't even go into that, but that relationship continues to grow. But the thing I want to discuss this evening is on our zero waste bill. And I will give you the bill numbers because I know, Dr. Torres, you want a lot of bill. I already have the numbers already for you, but I just want to talk about waste justice. You know, when we look at our city, New York City, okay, we send more than 14 million tons of trash to landfills every year. 14 million tons. We are 10% of the nation's total waste. And we talk about other cities and everything, but New York is sending its trash to Jersey, Pennsylvania, South Carolina, Ohio for processing. Landfills and processing, including sites like waste incinerators and burn facilities, are more located in environmental justice communities like Northern Manhattan, and they produce a high rate of amounts of harmful pollutants that lead to respiratory illness and cardiovascular disease. You know, we throw out a lot of food, over 4,000 tons of food that we're throwing out regularly, you know, and with this pandemic, with the little restaurants having these little outdoor booths, it's a haven for rats and pests and pesticides. So We Act is supporting the City Council's zero waste bill. The zero waste bill package calls for an immediate passage of, and I'll explain these bills shortly, to make sure by 2030 we've achieved a zero waste city. We can't keep doing the same things that we've been doing over the years and expecting a different result. That is what we call insanity. So in a suite of bills, there's just want to make sure I got it right. There are 6 bills, intro 0244-22, and I will send this link in the chat. This calls for universal curbside composting. We have intro 0274, which tasks the city to make sure that there is a waste diversion goal by 2030. We're talking about 0275, which requires the Department of Sanitation to report the city's progress on how we're going to get there. You know, a lot of times they say they're going to do something, but there's no website or portal to let you know part A has been accomplished, part B has been accomplished. We have 0280, which requires at least 1 community recycling center in each community board district. And 0821 requires that 3 organic drop-off sites are placed in each community district. I'll put the link to this so you'll have it, but this is a big bill. Now, what I'm asking, and we're just passing information out, the community board can play a big part. It's being held by the speaker, Speaker Adams. It's on the desk. They just got to pass it. But as you know, we have an upcoming election, so they're always going to pass the buck and say, oh, that's more important. We Act has to, along with the community board and other stakeholders, make sure that we're advocating to get this done. 2030 is not that far away. This pandemic started in 2020, and we're already getting ready to roll into 2023. So just how fast has that gone by? And now look where we're at. So 2030 is around the corner. So I'm going to put a link in the chat to the bills. And then what I'm asking, contact Speaker Adams. I'm going to put the number and her email there to say, hey, why are you holding this up? This benefits not just Northern Manhattan, but the entire city in reducing our waste. Remember, for those of age, there was a time where we were burning trash. I grew up in NYCHA. I grew up in grand houses on 125th. They used to burn trash. Just put it in there and then go down, it would get burned. Of course, we don't do that anymore, but there's still the lingering effects of making sure that waste is not in our community, but that we don't pollute other communities across the seaboard. So I'm going to stop there. I'm going to put the link in the chat for this zero package, zero waste bill package. And I'm gonna put the speaker's contact information to say, hey, we want this passed immediately before the election comes. Because, you know, by the time October comes, it'll be election. Then when the election comes, everybody's gonna check out and we ain't gonna be able to get this done. So I'll put it in the chat. And if anybody has any questions, and it'll also have the contact information for the WEAC member that's taking care of this project. So I just put it in the chat for everybody.
Bailey,
Yes.
let me ask you this. Is there, as an aside or a sub text to that bill, something dealing with rats or rat control in the city? You sort of touched on it with the way food is being left out by restaurants, but is there enough of a subtext? Because there have been from time to time over the last number of months, just this year, that a lot of people are talking about rats in District 9 in our community.
Yes, one of the bills, I don't know which one. I put the link in there. I don't know which one it is, but one of it does address that. So let me just make sure.
I know that our council member is also one of the champions. Councilmember Abreu is also pushing for landlords to have better storage of their garbage, and also decreasing the window in which the garbage sits in the curb. Maybe Amber can also speak to that.
Sure. Yeah, we're calling it the RAD Action Plan, and it's a suite of 4 bills that we're really excited about. And you described them pretty well. You know, we're working with to ensure that there's better containerization, just putting trash in trash cans so that that are rat proof, so that they're not getting into the trash. We're working to change the pickup times in the parts of the city where rat infestations are the worst. So instead of trash sitting out on the street all night, we want to put it out in the early hours of the morning and get it picked up in the morning as well. So there's not a big rat feast happening all night. We want to we want buildings that are under new construction to come up with a rat mitigation plan. So that means that a lot of times when new buildings go under construction, it just kicks up a lot of you know, rat nests, for lack of a better word. And that new construction can really cause a huge rat problem in all of the surrounding buildings. So we want them to come up with a plan for how they're going to deal with their rats before they start construction. And finally, we're making sure to take the penalties seriously for folks who are violating these rules. So, you know, we're making sure we have some good policies in place, and for folks who don't play nicely, you know, we're gonna, you know, make them pay for it.
I just want to also add to everybody on there, WEAC is also looking at some of the data with the New York City Department of Sanitation. And I don't have the link with me. I'm waiting for it to get sent to me. But we took a look at East Harlem, and I know it's not, of course, West Harlem, but we took one site in East Harlem, 116th and Lexington. They had one trash can for the 4 different corners. On East 86th Street, they had a trash can on every corner. So that is another part of, we're looking at the Department of Sanitation. Okay, why some communities have trash can on each corner and others don't? And we didn't do all of them because it's like this porthole that you have to look, and it's hard to pinpoint because they have these little dots, but we actually went out to look at that. And I think that's also important too. You know, trash pickup, and I'm using different examples, but after New Year's, all that confetti, but below 96th Street, 42nd Street there, it's cleaned up in a day. Snow is cleaned up in a day, but other parts of the city, the curb that you have to walk into the middle of the block when it snows. That has to cease. And the Department of Sanitation knows they're doing it, and we got to advocate to make sure that they stop it. So that's another thing about trash bins, because what's going to happen when people don't see a trash bin? Unfortunately, they're going to throw it in the ground. They're not going to carry it with them to their destination. So trash cans in Northern Manhattan, they're not as visible as we know below 96th Street. And that's just a fact.
And to act, to help help pass this bill, is it, what can we get information to, from you on? Texting? Well, letter writing itself may become a little difficult, but that's something that could be done. Telephoning our area legislators.
The
What
bill
other-
has been, it's in city council. They have the bill. It just now has to be placed. It's on the speaker's desk, but we're not getting any feedback on why Speaker Adams hasn't brought. So that's why I put her number. We can text her, call her, we can email her, but just put pressure. Like, hey, that's the only way, what they say, the squeaky wheel gets the grease or a hit dog barks. We got to just keep banging until we get what we need, because this is very important for our community of not just, again, West Harlem, but the whole Northern Manhattan area of why is these things just going to sit on the desk and not be addressed. So I'm going to put Annie Cafaro. She is the climate justice organizer for We Act. I think there is a tweet that they're tweeting out as well. So, but I'll put her email in there and you can contact her as well.
Other
Yeah.
than our council member Abreu, have other council members in the city also expressed grave concern about this in areas like ours? I'm sure this bill affects more than District 9, but other areas that are like ours, has there been that kind of voiced support for this particular bill, when it does come before the floor?
Yes, if you, the link that I put in there, it'll have them all. So Sandy Nurse is also a champion for this, as well as Keith Power. So the muster is there. You know what I'm saying? Is we always talk about the same things over. Are they going to do the will of the people? Are they going to do the will of the people to make sure that this gets done? We're not asking to build a bridge. We're not asking for a new subway line. We're asking for basic human services that taxpayers pay for. Department of Sanitation, taxpayers' money pays for those guys to do, and women to do what they do. So why can't it get done? And we don't want to hear about this, that, and the other. We've seen what they do below 96th Street. So why can't you do it uptown and in the Bronx and in parts of Brooklyn and the Rockaways? Why can't we all get that?
Right.
So that's, yeah, sorry, Mina, I'm sorry. Thank you. I'm
No,
gonna shut up.
Mina is here from the Manhattan Borough President's Office. Hi, Mina. Is there?
Hi,
there's
Chair
something to say?
Laquita. Yes, I just wanted to add on to what Bailey was saying, in addition to the package of bills that, of course, Amber highlighted out of Councilmember Abreu's office. But in terms of other council members, a few months ago, the Borough President did also support legislation that Amber did allude to, that the primary sponsor is Councilmember Eric Botcher, and that is in regards to the new buildings and kind of ensuring that rat mitigation services are employed when new buildings are going up. And then I also did just want to highlight quickly, I know it was announced at executive, but our office, along with Councilmember Brady's office, is also hosting a rat academy. We're targeting this specifically to the West Harlem community. This was an issue that was brought to us by the West 148th Street Block Association. And we just want to make sure that all of West Harlem is included. This will happen on Tuesday, October 18th. That is from 6 to 8. And the DOHMH is very strict in what they require and how many attendees to ensure that this will actually be a successful Rat Academy and that it will actually take place. So they need at least 35 attendees. So for those folks that are on, I hope to see you on that Rat Academy just to be in solidarity. And please spread the word. I know Utah has the flyer. So please, I just ask that you spread that information. And so that we can also have Rat Academy to, make sure that the surrounding managers are, aware of what needs to be done to ensure that rats aren't having big feasts in the streets and areas. But we do know that this is a larger issue that really does need to be tackled with legislation and appropriate funding to sanitation, health, DOHMH, et cetera. But I just wanted to highlight those two things. But I'm here to just listen in on the meeting as well. So pleasure to be with you this evening.
Thanks, Mina. And then I just looked, Monique, I hope you haven't had your hand up too long. I'm sorry I missed it.
No
You have a
problem.
comment?
No problem, Chair. I actually barely addressed it very eloquently in terms of having the need, Louis Bailey, having the need for more trash can receptacles. I mean, up here in this immediate area, there's literally one trash can on St. Nicholas Avenue and 146th Street. And of course, you're gonna have issues with rats if nobody has a place where they can drop their garbage. And so not only do we need more trash cans, we need to look at trash cans that are rat proof to help support the efforts of tapping down on the rat population. So I wanted to make sure I stressed that. And of course, we're on top of a major subway line. So that doesn't help with the encroachment of rats in this immediate area. So those are all things that have to be taken into consideration. And Bailey, I'm glad that this bill is being brought forth, and certainly looking forward to some of our other members on the call in terms of strengthening their efforts to help us tap down on this really terrible infestation that is putting our community under siege. Thank you.
Thank you. So it looks like the zero waste bill is certainly something we should get behind. And so we could talk about that soon as we move forward. Thank you, Bailey. And I believe
Thank
that
you
was
so much.
in terms of the pressing things. As we, let's see, it's time to move forward. I don't think I've missed anyone else, but a large issue.
Like Rita, we have Nick from the NICENA, the nurses.
Oh, okay, I see Nick here. Okay,
Yeah.
should we, before going to 1727, okay. And Nick had indicated, I just wasn't sure if it was going to be this meeting or the October 3rd, but you had called early on in reference to this. Is there a brief statement?
These are the nurses from Sinai.
From Mount Sinai, okay. Who else from Mount Sinai? Edwin, who else from Mount Sinai?
I believe we only have Nick, to give us some preliminary. Nick, you can speak.
Nick?
Hi, sorry. Yes, bear with me. I was just coming out of an elevator. Yeah, no, I'm apologize that I don't have any of our members here with us tonight. But we will be here next month for the October 3rd meeting. We'd like to discuss some of the unsafe staffing issues, not only in our hospitals at Mount Sinai, but uptown as well in Columbia Presbyterian. And we're going to be going into our contract campaign pretty soon. We're going to kick off in October, and we would definitely love to have your support. I know Jeremy, who regularly staffs this community board, is in the process of writing a community board resolution that we hope you guys would be interested in signing on to. If there are any questions that you guys might have of us, I'm definitely available to take questions. I might not be able to answer them, but I'll take them back to my colleagues and see if I can get you answers as soon as possible.
I know there was a resolution that the community board did vote on, voted yes. I think that was a year and a half ago, if not 2 years. So, and there has been some discussion about a new,
during the pandemic, we passed a resolution.
During the pandemic.
Yeah.
And so if you do have a resolution, just, it could be combined with a discussion with specifics on what you think you would, you can draft one in terms of what you think you need support with. And that could be a feature of our October 3rd meeting.
That's great, and I can send that to you guys for review.
It's a draft of what
Yeah,
you
draft.
need
Yeah.
support with.
I think Jeremy already has a draft, so I can get that to you guys this week and get it to the board this week. I mean,
Okay, so we've discussed a couple of bills from the council members, Abreu's office. We've discussed a bill, and because we do want action to take place in our from our community board with support or helping our district move forward. And so now one from the nurses, because these are services that we all need and improvements that we can all appreciate and benefit from.
And you know, I would like to say with these things that we're talking about, these are social determinants of health that we're speaking of, right? When you have one trash can in one community, not only people throw it in the floor, they might throw it in the trash that is overflown.
Right.
When you have a hospital that is not well staffed, your zip code matters more than your genes for longevity. This is well studied and is already established, and in the public health community is very well known. So we have to fight back on these inequities that, as we see, are man-made. There's no reason why certain communities get 4 trash cans and one gets 1. There's none. This is just, you know, purely intentional, and we cannot accept that as a reality, that just because you live in a certain community, you are subject to lesser of a quality of life because of the virtue of your zip code.
Thanks, Edwin.
I agree. It's structural and environmental racism.
Yes. And I'm glad we have, again, that just brings me to Ms. Levine, and we need to talk soon because there are ways we need to just highlight to our community that we're, you know, we as a community board are aware of what's happening in our community and that we're representing them and fighting on all our behalf. So I think the messaging to them will be really key, and this could be a strong time or an apt time to do that. Speaking of resolutions and letters of support, we certainly have several of us have talked about that in reference to 1727 Amsterdam Avenue. There's a big development about a development that we learned of late in August. And we had a very, very informative meeting at our executive committee meeting. And of course, it highlighted things we didn't know, some things we may have heard, some things that were erroneous. But most of all, it highlighted that we need to be aware of what's going on, what other agencies are doing, how all of that is impacting the entire community, and how we need to be abreast, aware, so that we can inform our community. And so we can help, maybe the development will be positive or beneficial, but we need to ensure that that happens. So the 1727 Amsterdam issue is a big one. 1727 Amsterdam as an address now houses at least 3 health services. One, the Jackson Center of Optometry. There's Heritage Health and Housing, which is a federally, what is it called? Federally recognized clinic.
FQHC, Federally Qualified Health Center.
Yes, Federally Qualified Health Center, FQHC. And that's very rare to have those. Not every, there aren't that many in the city. And I think there might only be 5 in Manhattan. I'm not sure of that number. That was at one time. There may be 6, but that's a very special qualification. And the other is the Emma Bowen Community Service Center that provides mental health services for children and adults. And at one time, the city of New York, the Department of Health and Mental Health housed the child immunization service, which would have been really key for everything we've been talking about, whether it's polio vaccination, COVID, monkeypox, all of that in terms of adolescents. But now we have another issue, and I'm going to let, we have here at least the Emma Bowen Center represented. I did put calls into Heritage Health Center and to the Jackson Center for Optometry. Maybe at some point we will hear from them. But we do have the chair of Emma Bowen Community Center here, Ms. Patricia Jordan. I know that Tom Haggerty, the executive director, is here, and Lawrence Fowler, who is, I think, assistant or associate executive director. And if there's anyone else here that you can identify, Ms. Jordan just mentioned. But let's hear the story of what's happening at 1727 Amsterdam. And I brought up resolutions and letters because the community is so fired up about it. We feel we have to really open up the communication with key people already making plans. You're on.
Hello?
We can hear you.
Oh, okay. Didn't know if you could hear me or not. First of all, good evening to everyone. And again,
Good
thank you
evening.
for good evening, and thank you for the opportunity to be here. The 1727, the Emma L. Bowen Community Service Center, which at one time was known as Upper Manhattan Mental Health Center, Inc., as you know, provides a range of mental health, addiction services, and supportive services, including all of our wraparound services. And these services are conducted and carried out in one location, which is very important. So we have been informed that the health and hospitals, that there are plans to develop the site into affordable housing and supportive housing. And I might add that health and hospitals, the property is owned by the city of New York. We're a tenant there. We're one of the tenants. And the health and hospitals is responsible for operation of the building. So the site is scheduled to be developed. We've been in discussions with health and hospitals. The developer that has been identified is BRC, the Bowery Residence Committee. So we have been in conversation with all three. What we're doing, and I think the conversations are moving on fairly well, is to plan for the ML Bowen Community Service Center to temporarily relocate while the construction is taking place, and the plan to return to the site after the construction is completed. When we were informed that this redevelopment would take place, we had four major concerns. One is that we are able to continue to provide the vital services so much needed by the community, and that these services are provided without minimal disruption. Also, that our services will continue to be located in one location, which is very important. That there would be funds to cover relocation associated with the relocation during the transitional period, the temporary relocation, as well as the return to the site, the newly developed site. And those funds have been secured with the assistance of Manhattan Borough President. So we're good to know that one of the conditions and concerns that we had has been addressed. And very importantly to return to the redeveloped site means that we need to be able to come back with an affordable rent. So those are the four major areas. This has not been finalized. We're getting actions in good faith, but everything is still being developed. It's very importantly that we have the adequate space we need to make certain that we continue with the services as they currently exist at 1727 Amsterdam Avenue. And I might add, this has been our home for the past 35 years. And it's important that we continue with providing this accessible mental health, substance abuse, treatment services, and comprehensive supportive services for our tenants, for our clients. That is an overview at this point. And I would also like to take this time to thank Councilmember Brewer. He has been very supportive and advocacy of the ML Bourne Community Service Center, and we thank him for acting on our behalf as an advocate, which we greatly appreciate. There's a lot to be done. No, nothing's really been finalized. And I also would like to add that when we were approached about the site being redeveloped, we support the need for supportive housing, and we support the need for affordable housing so that this can be made available to the community. But at the same time, we wanted to make certain that one critical need was not displacing or replacing another need, which is the mental health services that we currently provide. So this has been part of our concern that has been expressed, and these concerns are being addressed as of now. Have not finalized. There are good discussions taking place, and that is a capsule of where we are and what is being planned.
There was a great response from different members of the community for several reasons. I believe the first is that word of this to the community board sort of in an underground way. And so it was at the last minute, and it seemed as if something was going to be done very quickly, and without knowledge, no one had brought information to the community board. There seems not to have been a community needs assessment. Maybe there was, but there was nothing apparent in terms of the information given to us. We were pleased based on Barry's, our chair, Barry Weinberg's dogged, follow through, where we had Deborah Brown from HHC Health and Hospitals Corporation at the meeting, along with Miguel Guadalupe, who is with Bowery Resource Center. And there are a couple of other names that I are not coming to me right now, but the Bowery Resource Center apparently has been selected to develop that area from the standpoint of housing. So in this discussion, there are really two aspects, two components. There's the need for uninterrupted community health services that we have in our community that we really don't want disrupted. And then there's the physical plan, the actual facility that comes under, I believe, HPD and as well as HHC as the owner of that land. So what we can discuss now has to do with our concern with the community services. As Ms. Jordan mentioned, seems as if what has been stated is that that service will move to another location. Seemingly the location is 135th between Broadway and Amsterdam. And after full construction of the site, the center can move back in. We're not sure where the other two agencies will go, what will happen. One of the things I was trying to find out from them is whether they would stay in our district. These are services that are needed, very much needed, and they're well-used services. But we feel as a community board that we were out of the loop and that we can be very helpful in providing an overview. And we know our communities are in the selection. We've done it a lot. And we wanted to make sure, especially in terms of housing, that it just wasn't something put up just to be put up, when there are facilities or agencies like Broadway Housing that has the whole person in mind, has been sort of holistic in how they have built and developed their housing and services jointly. So we have great concern. Ms. Jordan?
Yeah, I just wanted to add, Dr. Jackson is planning, consider sharing space with the Bowen Center at the 135th Street, 520 West 135th Street. He also wanted to let you know that he will return your telephone call. He was just not able to do that, but he plans to do that tomorrow. And he asked me to send his apologies. So yes,
Thank you.
but those are his plans.
Now, you said, did you say what was the address you gave where Dr.
Well, where we plan to relocate temporarily during the construction period, which is 520 West 135th Street, and as you said, between Amsterdam and Broadway, and closer to the Broadway side.
Edwin, there was something, I'm sorry, if there was something you were going to add. I'm not sure. I can't hear you.
I have a lot of questions, and one of them is that, you know, there's not a community impact assessment. And we asked for that during the, maybe that's not for you, maybe that's for the developer, maybe that's for, you know, those who are leasing the site, or perhaps it is for you guys, but we would like to understand, you know, if such was done for us to get how this is impacting the community. How do you foresee this impacting the community? How do you foresee this impacting your clients, right? I know the talk started back in 2020 or prior, and a lot of things have changed since that. And I think that as we have seen, as we continue to see, COVID has thrown mental health into the forefront. It was there, but now it just put it a mile ahead. And we have to be careful when we're moving services around, when we're moving staff, how that, you know, unintentionally impacts the community. And I think that, you know, that report hasn't been clear to me. It hasn't been provided. You know, again, I don't know if that's going to come from you guys or the developer, but it is something that a community health assessment, an impact of how this is going to, you know, impact the community in the interim while it's happening and after, because there is a plan as to what's going to happen now when the construction is taking place and after the construction happens. So we would like to know this because I think that, you know, we can work together on mitigating the impact that this will have in our community.
Okay. Yes, and Dr. Torres, we would welcome that intervention very much so, and be happy to have a conversation in terms of how to make that happen. That is our concern as well. We've been here for 35 years. Our founders struggled to make certain that there was mental health services in the community when there was none. So we want to be certain that no one is hurt by the moving around the programs and services. When we had our conversation with health and hospitals, another concern that we raised is that we were in the middle of COVID at that time. We were in the middle in which there were so many Black and brown families and individuals that had been affected. And to think about trying to move mental health services around, or even maybe not include mental health services during this time, was totally unacceptable. And, we can only go forward if we make certain that we continue to provide these vital services. In terms of any assessment, we welcome that.
But yes, there's also an assessment from you guys as to how this new facility will help with increased capacity, increased demand. Would it allow you to do more of the work that you're doing? Will this space that you guys are going to get, does it constrain you from doing some of the work that you're currently doing? Does it prevent you from bringing more capacity in?
You raised the same concerns that we have. We're looking now in terms of the space to make certain that it can adequately accommodate all of our staff, all of the programs. And that's the stage where we're in now. In fact, we'll be having some assistance from architects to look at that particular issue. It is a concern. And we want to make certain that not only do we have space to house all of our programs in one location, but we don't want any of these programs and services being squished together. We have to make certain that our therapists have office space. We have to make certain they're in compliance with HIPAA. For our preschool, we have a lot of regulations that must be adhered to in terms of how many feet there are between children. And so, yes, these are the concerns. And this is the area where I think the discussion has moved with health and hospitals and the developer. So any support will be welcome.
Well, if I can, I'm Barry Weinberg. I was chairing the meeting Thursday,
Yes.
and I'm chair of the full board.
Yes, Mr. Weinberg.
Good to have you with us again, Ms. Jordan. One of our concerns that we've expressed is the current facility offers about 59,000 square feet. Obviously, Heritage and Dr. Jackson take up some of that, but has there been any sort of definitive or even preliminary discussion of the amount of square feet that you could be returning to in the new development?
Yes, there has. And we need to have an architect look at that design, because what is being suggested at this point, we don't think would be adequate space for us, even though we understand that in a new building, it's gonna be modern and probably can be set up a different way than where we currently are. So they're looking at possibly the community space, which is around 17,000 square feet, but that is not final. We have to make certain that we have enough space for our programs and our services. So that is part of the discussion.
That would be a reduction of 42,000 square feet, or no, 42,000 square feet in terms of total community facility space compared to the existing space, which is all community facility and is 59,000 square feet.
Yes, well, yes, as you said, the 59,000 includes space for the other programs. And I believe, Tom, correct me if I misspeak, but I think it's around 32,000 where we are.
That's exactly right. It's 32,000 and it's very inefficient. With efficient space, we're probably looking at 25 to 26,000.
Can you write those numbers down, because I'm not.
Tom, will you repeat those numbers, please?
Right now, we're currently occupying about 31.5 to 32,000 square feet, which is very inefficient at this building because it's old. With a new efficient building, we could do the same with about 26 to 27,000 square feet.
But but they're trying to put you in 17,000 square feet is the preliminary number that you've heard for the new building.
Yes, that is correct.
And do you know if you would be the main or sole occupant of the community facility space, or would that be all the community facility space in the building? Do you know?
No, we will be the sole occupant, and the actual space that they have, community space, for communities to come in, that would be a dedicated space for the Bowen Center as well.
So they're trying to downsize the mental health component of the site, probably to avoid a rezoning, if I had to guess.
Okay, yeah, well, yes, and according to their preliminary design, is that since this will be a new modern building and more efficient, is that they think that all the programs can fit in that space. So that's why now we'll be moving to the stage of having our architects take a different look at the space.
It'll be 3 times as efficient. I'm skeptical. I believe what you're saying. I don't believe what they're telling you. I appreciate that.
I'm in the same page as Barry. Do you foresee, Tom and Pat, that your services will be more on demand over the next 5 years? Same or less?
Some, I think there will be probably more, given what we see taking place in the community, not just in our communities, but across the city. We think there will be more.
And that's what we are concerned, that they'll be giving you less, and the demand will be more, and that's going to create a stress for the community. And we already have a stress system, and they're going to bring more folks into the community that will need more services. It doesn't make no sense that we'll give you less, in the name of efficiency. That's what what the MBAs like to, call when they come up with a great plan. But we know what that looks like when we throw the word efficiency around. Less services for the community, people cram, and the reality is that these services will be needed just the way the community looks. We are expecting for these services demand to increase.
Yes. And that is the point where we are at now, and having architects look at where we are, and based on where we are, what we need when we relocate to another location.
It's interesting you mentioned architects, because in all of our conversations with the developers in HHC, they always insist that they're very, very preliminary. But one question that you could help us with is, when was the Emma Bowen Center?
Excuse me. Sorry, one moment.
Sure.
Stop. No, my dog had a cramp and he was limping all over the place. Okay, sorry. Sorry about that.
That's all right. But one question that would be helpful to us is, when was the Emma L. Bowen Center director or board notified by HHC that this site was a candidate for redevelopment?
That was in around late 2019. Very late. Yeah,
That makes sense.
Yes, and at the time it was just all very preliminary. In fact, we weren't even certain for a while, based on information we received, that the project was going forward.
Right. Well, we're 3 years later from preliminary now, and they're still claiming it's preliminary. The final question I have at the moment is about the long-term sustainability of the center when it moves back. Has there been any discussion with HHC and/or BRC about making sure that the rent level that you are charged for the space is something that your services can sustain? Because if memory serves, when you presented to us in May, your presentation included a slide of your funding streams, and the bulk, if not the majority of them, were from Medicare and Medicaid. Is that right?
Yes, that is correct.
So, Medicare and Medicaid are not known for overly generous payment structures. And so, it's understood that Health and Hospitals Corporation is fundamentally in the business of losing money to provide care. That's what a public service is that we collectively spend money on something that we all need. And, it would, and in that same vein, that's how I think we view the Bowen Center, even though you are not operated by Health and Hospitals Corporation. We don't expect them to profit off of you either. And I guess, so that's my question, and the background of my question is, have there been discussions about making sure that whatever rent is charged, if any, to the Emma Bowen Center when they return, that it is at a level that their patient population can suitably sustain, given that most of them are Medicaid patients?
Yes, from the very beginning, as I stated earlier, there were 4 areas of concern that we needed to have addressed. And one of those areas was affordable rent at the newly developed site. There's been a lot of back and forth discussion, and I think they have identified around a number that I think would be affordable.
Okay, so there's been some give and take on that, and it appears that there is some progress.
Yes.
All right, well, we'll probably wind up doing something to throw all of that out the window by advocating for more square footage, but it's good to know. It's good to have the awareness of the situation.
Let me say something on the square footage for a second.
Yes, Mr. Haggerty.
We would certainly like to have a lot of square footage, but we need to be cognizant of the rent and what it's going to cost us when we move back there. Even right now, moving back at 25,000 square feet, it's going to cost us double what we're paying now.
Wow.
Why?
I mean,
yes.
Wait, hold on. Why? Why would it cost you more if you're getting less square footage?
Because of the rent per square foot
is higher.
That is correct.
Yeah. Well, thank you for that information. Thank you for that information, because I mean, they talk about having a commitment to the community and helping the community and all this nice rhetoric that we heard. I don't understand how this is helping. We're going to double your rent. We're going to give you less square footage, and somehow we expect for you guys to do magic and see more people. The ultimate folks who get affected by this are the patient in our community, not the developer who doesn't live here. Providers will be stressed, the center will be stressed, but this is the total opposite from what they told us on Thursday. Monique, I think you had your hand up.
Yes, I agree. I mean, the more we hear, the more disturbed I become. And once again, there appears to be little consideration or proper assessment was done. And it seems like, to me, that there's going to be a reduction in services. We're only talking about services to the Emma Bowen Center. And we're not clear about what that impact will be on the other services that are currently housed in that facility, and what that will look like when they come back. So I am concerned about a reduction of services overall, services that we desperately need. And if these services are reduced, is only going to exacerbate conditions that are presently existing and we are witnessing in the community. And as our chair said, the whole point is you are providing a service that is the public good. So there is no profit margin that should be of concern. I'm not saying that you should go into the poorhouse, but you're there to provide a service. And it's just outrageous that we're hearing that you're going to be expected to do more with less. It's unconscionable. So I'm sorry, I just had to state that.
No, if I may add that we clearly hear the concern and we're very much aware of that concern. And I will state that so far, Health and Hospitals and BRC have been acting in good faith as of now. BRC will be bringing in an architect. They are quite aware of the concerns that we have about the program space. And so the architect will have to give us a better indication of what the real number might be and what we need. So that's where we currently are. The RC will bring that architect on board, I understand, hopefully before the end of the month, or by the end of the month.
Ms. Jordan, you know, when the RFP was put out for the architect, do you know about when they started bid for the architect?
Okay. There was not an RFP, request for a proposal. There was an RFQ. I forgot now what the Q stands for, but basically what it means is that they tried to identify what developers would be available at the time when they were ready to begin planning to move forward with developing affordable housing and supportive housing. So it was not an RFP, it was an RFQ.
Do you know about when they put that out? Do you know? Know about when that request was made?
That was made, I'm pretty certain, sometime back, probably several months before, or maybe longer, before we were notified.
Also, that takes it back to mid in 2019 or 2018. Oh, wow. So it goes back farther the more we dig into this. Okay. I'm sorry, Edwin. I'm
sure that, you know, the Health and Hospitals, they can provide more detailed information. So, but it's definitely not an RFP, it's an RFQ.
Yes, I'm not so worried about that part. It just indicates how far in advance they really were on this plan without, you know, others in the community or the community board knowing about it. So they're much further along than they've indicated. And that's one sign. I'm sorry, Edwin.
I honestly think the more I hear about this, that there has to be a true assessment of, like I said, the overall impact that this is going to have. Pat, I put several resources there from the CDC on these community assessment tools that can be used. I am sure that Health and Hospital has capable folks that can help with that. The same thing goes to the developer, but we need to see that in the community board. We have a lot more answers the more we continue to question on this, because we hear that your rent will go up twice. We hear that you're going to get less square footage, and this is only one organization that is in that building. How about the others? An assessment would allow us to see the full picture of what's going to take place, and you know, and how this is going to impact us. You know, it seems like obscurity was the recipe under which this development was, you know, started. And now that it's coming out, it's like an onion that the more you keep peeling, the more it keeps coming up. Thank you for letting us know, Tom and Pat, about, you know, the challenges you guys will be facing, because if you're facing those challenges, the community will be facing them. And we have to get ahead of this before our people are not able to access the critical service that they need because of other constraining factors.
Exactly. Yeah. And in the meantime, we will, you know, keep you abreast of the discussions as they continue around the space and the architect that BRC will be bringing in. So, and they're aware of our concerns, very much aware. And they appear to be trying to act in good faith and seeing what can be done to meet our needs.
I think, you know, that's good, but we also would like to keep on our breath as to whether you also face challenges,
Yes.
you know, with your clients that will be moving, how they, you know, perceive this, because like I said before, this is right on a bus route. And access to many folks in our community is important. Transportation is a barrier to getting healthcare. And that is something that we have to plan for, think about. And what happened with those folks who cannot access now the Emma Bowen Center because it has moved? Where do they go? Is there, you know, does Elfin Hospital has any contingency plan as to what resources they will get them that will be expedited? As we know, if you call, you know, the hospital trying to get an appointment because you're dealing with anxiety, depression, it'll take you at least 6 months before you can see somebody.
Okay. Yeah, well, fortunately, we do not have a long waiting list. We're very fortunate about that. And we will be continuing with some of the telehealth services as well. And we make transportation MTA, sorry, I'm going back old school. We make transportation available to our clients now if they live a certain distance from us.
Awesome.
And yes.
Any questions?
Also, Ms. Jordan, if that's enough space or privacy or separation needed for the child and adolescent services when it's when you go back.
Yes, we have that information, and Tom has shared that with Health and Hospitals. They asked for that information as well, so they have it, and they'll be able to look to see exactly what we need, and they have a fairly good understanding.
Now it's very private for the children, and at the same time, it seems very wholesome with that separate recreation component to it. It seems like it would just ostensibly seem overcrowded and not appropriate if they're squeezed into closer to the adult.
Okay. Tom, excuse me, Tom, you want to speak to that because you have the most recent information?
This is with the therapeutic preschool?
Yes.
Yes, we've been in touch with Kathleen Gribbins, our associate director at DOE. And, you know, she's indicated that the school can be on the floor with all our other programs as long as it has its separate entrance and they have their own bathrooms. We're not going to be on 4 floors like we have now. We're only going to have 2 at the most. So one of them is going to have to be separated for the therapeutic preschool.
Okay, see how that works. Do you think the space, well, right now, based on what you know for that separation, do you think now it would be 2 levels, ground level because of the children and the school, or everything 1 level?
No, right now, that's why we're bringing in an architect, you know, let him or her determine if it's going to be 1 level, we're going to be on 2. But what we do know is the therapeutic preschool does need windows for its classroom, so we have to be on the 3rd floor.
Okay. Okay. Were there other questions, statements, concerns?
No, not at this time. I think it's just very important that the architect is on board so that we can get a better understanding of the space that will be available. We've been told that the space that's allocated should accommodate all of our programs, but we need to have a final determination on that. And so the architect should help us in that area. And we will definitely keep you informed and make certain that we have a clear line of communications to you.
I do have one question, Laquita. your architect who is analyzing the needs for your space and how they can be accommodated with the most efficient floor plate, is he working off of preliminary plans from BRC for the total structure or for the 3 floors that, or the 2 or 3 floors for community facilities?
Are we talking about where we're relocating for the 4 or 5 years or coming back to the building?
Coming back to the building.
They're working off of their own 17,000 square feet that they want to allocate us right now.
Right, but so your architects that you're hiring to think about this in the, just to be clear, the space, the square footage numbers we've been talking about where it was 16 to 17,000 in the new space, we're talking about the building that you will return to in 5 years, right?
Correct.
Okay, yeah. And so, you know, the architects that you're hiring to kind of try to work this out, are they being given any parameters for the new building that you will return to by BRC and HHC and HPD? Like,
no, but we think that once they do their plan for the place where we're going to temporarily move, that it would justify us moving back to 25,000 square feet that we can't fit into the 16 or 17,000.
Got it. But you guys haven't seen any floor plates or preliminary dimensions on the new building from BRC?
Very rough drawings.
Okay, got it. Thank you.
So there in the chat, there's also, let me just repeat the temporary locations for 2 of the 3 facilities. The Emma Bowen Center right now is slated to move into 520 West 135th Street when construction, or right before construction on the building begins. And so is the Jackson Center of Optometry to share space with you at 520 West 135th Street. Are those the temporary locations as you know them now?
Yes.
Okay. All right, and then we have to figure out, I'm not sure how much square footage you would be using, and that is a big building, 520 West 135th, but you don't know if it is enough for Heritage Health Center or what they're doing. You have no idea. And I'm not saying you should know, but just in case it's been. Okay. All right.
Peter, I have a question.
Monique.
Madam Chair. So I assume the next meeting we're bringing HH or H&H back to ask more questions of them.
Well, this Thursday's meeting, I know it's may or may not have some of this, well, there'll be some feedback, but I think in terms of our committee, we should probe for more information at our next meeting. If anyone doesn't think so, just let me know. I know there's some noise in the background. And then of course, Signe Mortensen has been in communication. Signe is chair of land use and housing and land use committee, and there's going to be a lot of discussion there. So as it concerns this project, there'll be need for information or interaction with both committees. So yes, it's probably, I'm sure, October.
And to clarify, HHC, we requested that they attend this meeting tonight, and they cited conflicting obligations and said they couldn't make it, but they will be requested in October. It's unclear whether it would be productive to have them at our general board meeting Thursday, because I think that there's a lot we still don't know.
Right.
But from what I'm hearing now, this project as described to us by HHC and BRC does not seem acceptable.
Right. Yes, Chair. And that's my concern. I mean, Ms. Jordan is here answering questions only as she can from the perspective of their centered services. I want to say HHC, H&H, they're the
You're right.
You're right, it is HHC.
Health and Hospitals.
So they're the ones managing the property and I guess negotiating and doing all the things that are being done in terms of the architect. I find it ironic, we're talking about making sure we have enough services, health services for those of us in our community, and they are a health service organization, and they didn't seem to show the proper planning and consideration as it relates to health services, even though they don't render any services out of that property. So it's kind of mind-boggling.
And this is what makes them, I think this is partly what drives this, not to get too far afield, I'm sorry, Laquita, but like, I think this is partly what's driving this, is that Health and Hospitals Corporation is mostly an operator of hospitals and clinics. You know, I don't know if anyone caught it on Thursday last week, but they said that they weren't really sure how this property wound up in their portfolio. And if you look at the deed history of the land, it's not really clear that it is in their portfolio. I mean, the city has been having HHC manage it for many years, but the owner listed on many of the deed documents is the city managed by the Department of Health and Mental Hygiene. And so, you know, all of this to say is that this is a piece of land that HHC doesn't really care about, except that it wants to stop spending money on it. And, you know, presumably maybe make some money on it, depending on how much BRC is paying them in their lease, if anything. And then also, you know, they get to meet the mayor's housing numbers with it. But this is something we've raised at the mayor's office today. They are aware of it, and they are going to be looking more closely at it. But, you know, I think that I think that just what's driving this is HHC is used to losing money providing healthcare. It's a little less used to losing money being a landlord. And I think that, you know, they were like, why do we have this in our portfolio? What can we do with it? And, you know, HPD swooped in and had their ideas. And the other thing that I will say, you know, the community board's official role in this would be because we maintain as a board that this project has to go through the Universal Land Use Review procedure, ULURP, which is section 197C of the city charter. And item 10 in that section states that anytime the city disposes of or leases real property, it has to go through ULURP. And the first step in ULURP, after they submit the paperwork to the Department of City Planning, is to come before the community board for an advisory vote. The second step is to go before the borough president's office for finally city council. So we maintain that this project is subject to ULURP. HHC and others have said, no, it's not subject to ULURP. We're only building 9 stories, meaning that they're not trying to rezone it, which is another thing that causes ULURP. But it's our position that because they are leasing city-owned land to a third party, it very clearly is then subject to ULURP under the city charter. And so I think there is going to have to be some hard discussions and votes to make it clear to HHC that they cannot circumvent ULURP here. And honestly, the proposal as it's been given to us, knowing what we know about the makeup of it and the impact to the health services, is unacceptable currently and needs to be reworked. And also we have questions about why it took them 3 years to tell us, why they only told us begrudgingly after we had found out, and why, and then they got mad because there were rumors.
Right.
Because they selected a homeless shelter provider to build supportive housing. When people saw who it was, they assumed it was going to be a homeless shelter. That's not an unfounded rumor, that's a founded rumor. There's some basis for that.
Correct.
And so, you know, the whole thing, doing it in the dead of night for 3 years, being surprised when we found out, you know, being defensive about it, and now us finding out that it's going to be a reduction in facilities for mental health in our neighborhood, none of this is okay. And the entire thing needs to go back to square one and the drawing board, including we would like to get more details from them and HPD about this RFQ in 2019 and how BRC was selected, because that is still not clear to us and no one's given us that answer. So a lot to talk about in future meetings. We shall see.
If it quacks like a duck, then it's a duck, period.
And Victor, I'm so sorry. I noticed your hand, I'm, multitasking here, but Victor, you did have your hand up and I only saw it at the last minute. Please make your statement.
Just a quick question. We have people of contact at the other two facilities located in that building that we can correspond with?
Yes, I mentioned Dr. Ralph Jackson, the Jackson Center of Optometry, who actually was on our community board years ago. And via Pat Jordan this evening sent a message that he will return my phone call.
Okay.
In terms of Heritage Health and Heritage Health Center,
right?
They have a new executive director. Who I have put in a couple calls. Their board is the same. I put a call into one of the board members. I haven't heard anything, which is at least from the board member, which is kind of unusual, but I'll keep pursuing that. And I even left him a message last weekend today.
Okay, great. Thank you.
So we do have contact, Victor. Thank you. And if you need, I can make sure, you have the one contact, Dr. Ralph Jackson of the Jackson Center. And I can't recall the executive director of Heritage Health Center.
Gotcha. Okay, thank you so much.
Okay. Any other statement or feedback, comment?
I would just say that we should have the other providers from the from 1727, because we should hear from them also.
Yes.
They are providing services to the community. Just getting a provider to this community, it is hard. And we need to hear what they have to say also, and their experience with this whole process, and what they see their prospect will be like. I think that will give us a full picture as to how this is going to change this site with the current services that our community access, and then what it will look like after.
Yes. And that was part of the message left with them. And I'm hoping that I hear from them in time before the October 3rd meeting. At any rate, we will have some representation, I'm sure, concerning this matter at our October 3rd meeting and going forward. Thank you very much, Emma Bowen, Community Service Center, for
yes, thank you.
Being part of both meetings, the executive committee, once we found out what was what, and being straightforward, coming to us without fear, knowing that we support the service that you bring to our community, as we've stated in other meetings. And we hope that we can get transparent feedback and be a participant in going forward. It's kind of hard 3 years after the fact, but we're going to do all we can to do what's best for our community in terms of awareness and fulfilling needs of the community.
Thank you for the invitation.
Thank you again. So I think it's getting a bit late. It's 8:44. If there's the other item on the agenda can wait until next meeting. But is there any new business that anyone would bring up? Would like to bring up? I know Nick actually he talked, but he probably could have been part of new business. But he announced that the nurses have a serious issue that they want to draft a resolution for and will present October 3rd. I know Nick is still, yes.
I will say that for that meeting, we will try to have also Sinai present, so we can hear the nurses and also hear from Sinai, because as we know, our community is always affected when it comes to services. The ER at Sinai, I hear complaints from some of the community members that they have to wait longer periods of time because they see that, you know, they have an issue with staffing.
Yeah. And it's interesting because Amber brought up that same subject related to one of the policies and legislation that they want to address in ensuring what was it, length of time, waiting, creating a one-stop shop, et cetera. I think there's a lot that leads to, and perhaps Amber could make a thing at our October 3rd meeting as well. If Councilman Abreu is back in town, we obviously look forward to his being part of that discussion as well. Any other new business?
I think we have our hands full for the season.
We have
there's always new business coming.
Okay, I'm not sure I really heard that, Edwin. I'm sorry, we have some background. Okay, what about old business? If not, we are done for the evening and we can entertain a motion to adjourn. I want to, right before that, just give an overall thanks to Amber Moyer from City Councilman Sean Abreu's office, Mina White from the Manhattan Borough President's office, the Emma Bowen Center again, Lewis Bailey representing We Act, Pat Moore John representing New York Department of Health and Mental Health, and Nick Artur with New York State Nurses Association. Thank you so much for being part of this meeting, adding so much important information to our discussion of what we need to know. Now, can I entertain a motion to adjourn?
Before, I'm sorry.
Like to make a motion to, oh, sorry.
No, I'm sorry. Just want to interject that this Friday we're having our annual health fair. I know that I believe someone from the library committee will be there, and any information that we can give out regarding polio vaccines or anything else, we will be happy to do that. And we also will be doing COVID vaccinations as well. This Friday from 10 o'clock to 3 p.m.
Do you guys have a flyer that they can share with us?
Yeah, 10 a.m.
From 10 a.m. to 3 p.m.
Yeah,
at
yes.
1727 Amsterdam?
Yes, in the plaza area.
Is there a flyer that you guys have for the event?
Yes, we can get that to you immediately.
Yes.
Yes, can you please share with us?
Yes, we can share.
And if you can make sure that our district manager gets it, and you for Prince.
Okay, we shall. We'll head that to you tomorrow morning. Okay, and we're happy that we have Dr. Barbley as our MC from WVGO.
Okay, and you indicated COVID vaccine, including the new booster?
I can't respond to that, but we can get that information to you as well.
You said COVID and monkeypox, did you say too?
No.
Only COVID.
COVID.
COVID, did you mention polio?
No,
Just
not
COVID.
vaccinations. If we get the information, we'll be happy to try to distribute it. Or if there's someone who wants to come and have a table to talk about the polio vaccinations and the need for it, we can accommodate as well.
Mr. John Pat Moore John put some information in the chat. I'm not sure if you picked up on that. But there's information that because they do want to work with community organizations.
Okay, very good.
Information.
Okay, Larry, anything you need to add? Larry? No, guess he's gone.
No, no, I'm here. I'm here. but
Okay.
No,
Okay.
nothing to add. Nothing to add.
Okay, okay, good. Sorry
Okay.
for the interruption, but I
Oh,
wanted to get-
that was short. That was brief and important. Okay, Monique, you're on for the motion.
I would like to motion that we adjourn the meeting at 8:50. Would somebody like to second that?
I
Second the
second
motion.
it. This is Patricia Ramos.
Oh, there's Patricia.
Thank you,
Okay.
Patricia.
All those in favor?
Aye.
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 Thank you. The meeting is adjourned at 8:50. All right. Thank you very much again.
Thank you all
everyone.
for attending.
Good
Good
meeting.
night.
Good night.
Good
Good
night,
night.
good night.
Good night, everyone.
I'll get some notes over to you both, Edwin and Laquita. I took some notes.
Okay,
Thank
I
you,
did
appreciate it.
too.
I took some notes too, so we'll
That's good.
combine them.
Okay.
Okay, yes, yes. Okay, thank you. Okay, bye-bye. Let's see. Oh, hit end.